Welcome back, everyone. We're here discussing the changing face of aging in Erie County. Our second guest today is Diane Bessel, who is the Director of Research, Investments, and Advocacy for the United Way of Buffalo and Erie County. Welcome, Diane. Thank you for being with us today. We really appreciate it. Diane, United Way is one of the area's major funding agencies. As I understand it, you've been involved in this study for a while now, not targeting necessarily older adults, but part of the target population was older adults. So obviously your findings are going to be interesting in that respect. So what can you tell us? First of all, when was the last time that United Way did a needs assessment?
It has been some time since the United Way has done a needs assessment. Actually, the last one that was done was in 1995, last comprehensive study that was done. And so it was time to dust that off, get some new measures out there, get a good picture of what was going on in the community. And our focus in this needs assessment, as you suggested, is really looking at the changing population trends and also our three focus areas of education, income, and health and wellness. And then what are some of the overarching concerns that we have in the health and human service system? Things like transportation, things like helping people to navigate the system, because there's a lot of services available, but sometimes it's hard for people to get to them.
Right. And what were some of your major findings?
Well, we had a lot of findings. It's a 198-page report, so there's a ton of things in there. But some of the most interesting pieces are really the changing population trends, changing demographics that we're seeing. Buffalo and Erie County in general have seen some declines in the population. And we're all pretty much aware of that. But we are starting to see some emerging populations, some growth in some populations. One of the key findings was around refugees and immigrants coming into this community. Some of the challenges that they're facing. Many of them are not literate in their home languages and then come to the United States and come to Buffalo and have some challenges. Some parents with children in schools having difficulty navigating the education system, securing jobs, just being able to communicate and receive information in their native language.
Our supermarkets must be overwhelming.
Yeah, absolutely. And just even being in an urban setting, you know, what are the rules of traffic? You can't just cross in the middle of the street. Or the attire that you need. And so we are seeing some real changes around that, which was important in our needs assessment. Another population group that we took a look at is military veterans and those who are returning home. And Erie County is home to about 70,000 military veterans and families, many of them who are having real difficulties with the transition from their military service and the work that they did overseas in translating that into employable services here in the United States, here back in Buffalo.
Right, finding jobs.
Absolutely. So that's been a real challenge, and many of these families have faced financial problems as well, as perhaps the primary breadwinner's been off to war, we're making do with credit or what have you. And so some real challenges for that population.
Now, what was your process in doing the survey?
Well, we used a variety of different data collection techniques. First, we did some key informant interviews. We interviewed about 25 key community leaders who had a sense or pulse on the Buffalo and Erie County community. We also did 30 focus groups with consumers of services, with people who are just part of the community, with people who provide services in the community. We did some special outreach to various groups like the military veterans or refugees and immigrants, but also to seniors as well. We looked at 100 community indicators, so things from the census, from the Centers for Disease Control, health measures, all different kinds of things, just to get a barometer on where the community is. And then also we took a look at different research studies that are available to find out what are the best practices, what are the kinds of things that are working to improve issues in our community.
And as I said before, I understand that the senior population was not your target, but did you learn anything? Did you find anything, any interesting things about the senior population?
Oh, we sure did. We sure did. We did a bit of comparative study. We found out that Erie County is home to the 9th largest elder population, and I believe in your earlier segment, Randy talked about kind of the changing place where we find our seniors. A lot of people think, oh, seniors are in the city of Buffalo and they live in their homes, but we're really seeing an expansion in the older senior populations out in the rural and suburban areas. We also found...
That surprises me because transportation is such an issue.
It sure is.
To be moving further away from the city where there is mass transportation, that really is surprising.
The research that we've looked at nationally tells us that women outlive their decision to stop driving by about 10 years and men by about 6 years. And so being able to get to the store, get to a doctor was one of the major challenges that the people we talked to spoke about. We also know that our senior population tends to be poorer, frailer, and more at risk than senior populations across the country. We know that about almost 20% of seniors are having trouble making ends meet, which is a major consideration. But also, nearly half have some form of disability. Sometimes it's having difficulty walking, sometimes it's having difficulty kind of taking care of themselves or losing hearing, and so that's a real challenge. Couple that with the fact that a lot of family members are no longer available to help their senior, to take care of their senior, and we're seeing a shortage of people who can help. Care aides or nursing home beds, we're seeing reductions in those, and so we have a senior population that is facing a lot of challenges, sometimes alone, and so that's a real concern to us at United Way.
Did you find any correlation between, we have a lot of environmental issues here in Niagara Frontier. Did you find anything that would equate to why we have such a more frail senior population?
We didn't really look at the environmental issues that can add to that, but we know that people are living longer and experiencing chronic conditions, so you might not have a disease or a malady that
normal
causes
wear and tear.
Yeah, exactly right. So we have a lot of people who might have arthritis or high blood pressure or might be experiencing diabetes. And that leads them to be more at risk. Oftentimes, those kinds of chronic issues, those things that wear and tear, can kind of accumulate in a person's life, and that makes it difficult for them to live at home. The reality is most people are living at home these days.
They want to.
And they want to.
Right.
And so how do we support them in that effort?
Right. It used to be such a thing that, you know, if you lived to be 100, and now, I mean, you see on the Today Show, you see on the television all the time about people that are celebrating 112th birthday.
Yeah, and
I had a cousin that
I
visited yesterday. Her mother just turned 101. So the population is living longer, and that's raising a whole different set of issues.
It absolutely is. One other thing that we saw is that a number of grandparents are raising kids, raising their grandchildren.
Definitely.
And so think about, you know, you've got normal wear and tear, some aches, some challenges, and now you're bringing up kids. So more than 6,000 grandparents in Erie County are in that state of living.
And that has a bearing on their financial status too, because the grandparents don't get what a total stranger gets.
Exactly.
Right. Well, this was really, really very interesting. Now, we're going to bring Randy and you back for our third segment, and you'll be talking about, now that you've got all this information, what are you going to do about it?
Absolutely.
And how is that going to affect the services that are going to be given in Erie County? Our two major funders.